Good evening, and happy to have you join us tonight for the 5th workshop in our hypertension series. Wanted to remind you that these workshops are being offered through the Windsor Health Department with financial support through the Connecticut Department of Public Health. These workshops will continue for one more series, the 6th and final one that will be offered in 2 weeks on Monday, June 6th. The presentation tonight will be done by Dr. Atiq Mirza, and the presentation title is Adherence to High Blood Pressure Therapy. Tonight, we're doing it a little differently in that we will continue to record through the question and answer session, and we will conclude with a demonstration of the self-monitoring blood pressure device. Wanted to remind you to complete the evaluation and the pre-diabetes screening test if you haven't done so already. Once those are completed and received, I will be awarding the First Town Downtown gift cards, probably in that June to July timeframe. Another reminder is that these are intended to be educational workshops and not personal health consultations, which should be discussed with your primary care or your subspecialist. And with that, I'm going to turn it over to Dr. Mirza. Please join me in welcoming him. Thank you.
Thank you, Jenny. Thank you very much. Good evening. So today we will be again discussing about therapies of hypertension and how it is important to be adherent to those therapies. So if we can go to the full screen, please. All right. So as Jenny said, my name is Atiq Mirza, and I am a private cardiologist at Central Connecticut Cardiology. Our offices are in Enfield, Simsbury, and Hartford, and I'm also have academic appointments at University of Connecticut School of Medicine and also at Frank H. Netter School of Medicine, Quinnipiac University, Connecticut. So, now a reminder for all of us, as Jenny mentioned, these lectures are only for general introduction and information. Please always contact your primary care physician, cardiologist, or whoever you are following up with for your blood pressure, making sure you get the in-person advice. So today we'll talk about what is adherence and what the problem can be caused when someone is non-adherent to taking medications. Then we will discuss what are the causes of non-adherence to take the medications, and then how we can improve the adherence so that we can remember and take the medications at a regular basis. World Health Organization in 2003 defined the adherence as the extent to which a person's behavior corresponds with the agreed upon recommendations from a healthcare provider, and that adherence can be set for medications, following a diet, or making healthy lifestyle changes. When it comes to the medication adherence, it is the patient's conformance with the provider's recommendation with respect to timing, dosage, and frequency of medications taken during the prescribed length of time. So it's not that you have to take the medication only, it has to be taken in timely manner, in the dose appropriate way, and in the frequency with which this medicine has been prescribed to you. And I would like you to hear this loud and clear. Drugs don't work in patients who don't take them. So medications will only work if we take them. So this is a little complicated, busy slide, which starts from the core, is the social context of what predicts the adherence, non-adherence of the medications, then the health encounters, and then organizational context. So starting from the very core, where there is a cartoon of a human, which shows that there are many reasons at a personal level why people don't take the medications. One is personality. I just don't want to do it. The health. Are you so sick that you cannot take your medication? or you are not very sick and you think, oh, you know what, I have a little bit of high blood pressure. It's okay if I don't take it. Then the beliefs about the medication, though they don't work, they have side effects. And we see those patients who come across, and the attitudes is the same way. Then the social support and social barriers. Patients who have dementia, they don't know when to take the medications. Where are they living? Do they live at home, and do they have a support from the family, or social structure is such that someone is there to deliver the medications to them and make sure they take it? There are other social barriers, finances, financial issues. And we see that, yes, medication has been prescribed, but that's too costly that we can't afford it. Then comes the healthcare encounters, How was the interaction with the doctor and the patient? Because it has been studied, and we know the patients will only take the medicines if the doctors have explained them why that medication is being given to the patient. What's the dosage? What are the side effects? What are the benefits? If those discussions have not happened in the doctor's office, then people are less likely to follow up on taking the medications. Then organizational context, you can see the insurance coverage. Again, that comes to some kind of the same social barriers that, if insurance is not paying for it, most of us are not going to pay for those medications from our pocket. Then what kind of medications are those? What kind of disease they are treating, and what are the other characteristics of the medicines? How bad are the side effects? So these are the different reasons which come to play a role when a person becomes non-adherent, or these are the factors which predict people to act as non-adherent to taking the medications. So as we are discussing predictors of non-adherence, it has been seen in multiple studies that limited English language proficiency or low literacy rate is a major factor regarding non-adherence. Then comes the mental health issues like depression, anxiety, addiction, or dementia. Then are the financial constraints and the costs of the medication. Because if medicine is too costly, people have to decide whether buying the food or the medicine. So that's another factor when people do not get the medicine and then eventually don't take the medicines. Then different people have different beliefs about the medications. Not about blood pressure medicines, but about cholesterol medicine. We have seen very, very often that people have strong beliefs about statin therapies of the cholesterol medicines. And similar things do exist in medications for high blood pressure. Then people may think that these medications are unnecessary or harmful because they do not know the outcome of the disease for which that medicine is being prescribed if you don't take the medicine. Then people are very concerned about the side effects. And yes, these medications do have side effects because these medicines can cause tiredness, fatigue, and other chronic issues. So these are the other predictors why people don't take the medicines. Other most common reasons are, the major are listed on the left side, and then mostly other reasons are in a cartoon shape on the right side. So one of the major reasons is forgetfulness or concerns about the side effects. Low perceived or needed efficacy. People think, oh, I don't need it, or maybe medicine is not going to work. And obviously the cost, as we discussed before. And that's why people don't take it. So we know that when a prescription, I call it a prescription story. The reason I call it a prescription story, that in good old days when prescription used to be on a paper, because nowadays prescription is not on a paper, it flies electronically through the cyberspace and goes to the pharmacy. And maybe this reaching pharmacy percentage has gone higher than 70%, 50 to 70%. But if you have a paper prescription, only 50 to 70% reach the pharmacy. And once it reaches the pharmacy, I think the rate that it is picked up by the patient between 50 to 65% still relevant. Then after prescription is picked up, only 25 to 30% of the medications are taken according to the instructions or as prescribed. And only 15 to 20% of prescriptions which are refilled as prescribed. Because then once you take it for some time, most people don't go and get the refills of that. So I think it's very important to know that what problems can arise when we become non-adherent to the medications. What clinical or health outcomes are going to be there when we don't take the medications. And those are obviously the poor therapeutic outcomes. Hypertension is a silent killer. If blood pressure stays high and you have no symptoms, it can result in heart attack and stroke. It can further progress your disease. If it doesn't cause that much harm, causing stroke or heart attack, then it can make your heart muscle go weak. It can cause heart muscle to go thicker. It can cause to have kidney failure. So there are other reasons, which are little less than death, heart attack, or stroke, which can happen by not taking the medications. And that all results in decreased quality of life. A person who stays sick is not going to perform or have quality of life as a person who doesn't have that disease. Then the other outcomes are economic outcomes. If medicine is prescribed and is not being taken, first there is a loss of money on the medication which was prescribed, and then it was not taken. It increases the cost to the healthcare system. Not taking medication can result in increasing the hospitalization because more people will get sicker. More visits to the emergency room department. Increased doctor offices visits. And eventually it will all lead to the loss of productivity. We know that 30% of prescriptions are never picked up from the pharmacy. These are in a nutshell, what we discussed in the past 2 or 3 slides. 30%, 1/3 of prescriptions. And 50% of medications for chronic disease are not taken as prescribed. Half of the medications which are given or prescribed, we don't take them as they are prescribed. So this is a huge issue, and that's what results in bad health outcomes, bad socioeconomic outcomes, and prolonged illnesses. So it has been estimated that 10% of hospitalization in older adults may be caused by the medication adherence. So those people who don't take the medications, they will end up in the hospital. And amongst all, if there are 100 people admitted to one of the hospital, 10 of those patients will have the reason for the admission because they didn't take their medications. We do see in the hospital very often, and not necessarily that patients don't want to take the medicines. Mostly what we see is the social reasons that I couldn't afford the medicines. The non-adherence to the cardioprotective medicines, especially which protect your heart and the blood pressure and prevent the stroke and keep the heart circulation going and keeping you out of the heart failure, that results in 50 to 80% of mortality. So, because heart is an organ, I always tell my patients, being a cardiologist, that heart is the organ between your life and death. And when it comes to not taking the medications related to your heart issues, it's going to be a huge, big disaster and damage to your health. So, once again, despite the benefits of antihypertensive medicine, which most of us know, over 50% of US adults who take the medicine but still have uncontrolled blood pressure. So this is it was published in 2018 that those who do not take medications, that's a one category, that they are going to definitely have some problem with not, complications of hypertension. But even those who take it, still 50% will have uncontrolled blood pressure. So even if you take it, we are still not fully covered by to control the blood pressure. So think of those who do not take the medications. So that's why I'm just trying to explain how important it is to take the medicines. That even if we take it, our blood pressure 50% of the time is still not being controlled, because we'll have to go and get the either increase the dose or change the medications, because on average it takes 3 medicines to control blood pressure. Then the other statistics, which I just wanted to know all of us, that 125,000 deaths occur annually because of lack of adherence causes to the medications. And the total cost of non-adherence to the medication is between 100 to around $300 billion a year. 100 to $300 billion a year. If you look at this amount, this is many third world countries will not have this much annual budgets. So who doesn't take the medicines, and which age group, and who amongst the men and women are more prone to not taking the medications? So this is a very interesting graph. If you look at starting from my left, you have age range between 18 and 35. They are the one who mostly don't take the medications, around 58%. You move forward to the next group, 35 to 40, 47% don't take it. You keep moving to the 45 to 54, more and more people taking that, but still 37.5% don't take that. Between 55 and 64, 30% don't take it. 65, 74, 24% don't take it. You keep moving forward, the range stays between 20 and 30%. If we split these ages between men and women, men between 18 and 64, there are 34% who don't take it, whereas men above 65, 23% or 24% don't take it. Whereas the women who are younger, 18 to 65, around 40% of them don't take it. Whereas women 65 or above, they only 24% or 25% don't take it. So you can see more prevalence in women, more prevalence in younger people. The older you get, you start paying more attention to take the medications, but it may be too late to pay the attention at that age group. So it's important to learn this lesson that earlier we start taking the medications, the better it is for us, although statistics don't confirm that. Then if we divide the medications to different categories of medications. So first is that, I think our laser is not working here. So my left on my side is, angiotensin converting enzyme inhibitors. These are the medications given to treat the blood pressure, like lisinopril, captopril, enalapril. Those are all which end with pril. 23% of these medications are not taken. Then there are angiotensin receptor blocker agents like your valsartan or losartan, 20% are not taken. Then your angiotensin, renin-angiotensin system antagonist, 25%, beta blockers, 28%, calcium channel blockers, 28%, diuretics, 32%. And you see diuretics are higher non-compliance rate because they make you go to the bathroom. And the older we are, it's difficult to go, the frequency is already increased to go to the bathroom, and find the bathroom while you're running your chores or errands outside the house, it's get difficult, and most people don't take it. Then thiazide diuretics, almost the same. And there's other category which includes other non-antihypertensive medications. They come up around 43%. So then this study looked at that If there is a fixed dose that your doctor told us it's a 20 milligram, you got to take every day 20 milligram. Or your doctor told, you know what, one day take 20 milligram, next day take 40 milligram. So there was not a huge difference, but there was a slight difference. If the dose is fixed, people tend to take medicine more regularly as compared to when the dose is not fixed. So that's, another issue. Then the non-adherence has also been looked at from the pharmacy outlet type. If your medicine is coming from a long-term mail order pharmacy, they usually send you every month or every 3 months on time, and the adherence to take the medications in that population is higher as compared to retail pharmacy, where every month or every 3 months we have to go and pick up the medicine, bring it home, and then take. So mail order, in which it comes to your home, increases your adherence to take the medications. Retail pharmacy, where you have to go and pick it up and bring him home, again, almost 30 to 31% in that range, whereas mail order is only 20% non-adherence rate. So this is very interesting statistics. I thought I should share it with you. So what we learned from the last 2 slides, highest in among the younger adults. It also differs by the different classes of medications, although there's not a huge difference, but there is a difference. Then difference between the retail pharmacies and the mail order pharmacies. And then again, difference between if you're taking a fixed dose or you're taking a different dose every day. Then comes that what we can do to increase the adherence. So it has been seen that asking people about the adherence, because we all forget sometimes, asking your father if you're at home, or your wife at home, or your husband, or your kid if he's on medications, that, how often do you forget to take your medications? That will give them time to think about it, that should I, how often I do it, because if we don't ask them, we don't even know that we are missing it. We just say, okay, I don't take it a few times and I'll go okay. But when you sit down and think about it, that how often I didn't take it, then maybe that will improve your adherence. Other thing is, when the medicine is prescribed, it starts working, makes you feel better, and then you start forgetting more to take the medicines. So we all need to remember this. If the medicine is given to make us feel better, we need to keep taking it on a regular basis rather than forgetting it. Usually, it's very true in antibiotic therapies. You give the antibiotic to the person. After 3rd dose, if a 5-day medicine, 4th, 5th dose is missed because patient has already recovered 70% by that time. Then it comes a self-monitoring. Nowadays, every one of us, most of us have those iPhones in our pockets, and we are very dependent on these devices because those have become part of our lives. So we need to, if we are taking the medications, we first of all need to have a list of that medicine. And please have your doctor office print you a list, or sit down at home, make your own list by putting each and every name of your medication, dosage, and frequency. Keep it one in your wallet. I always advise my patients, and one on the refrigerator in your kitchen or any place which is visible. Because if, God forbid, you have any health emergency and EMS is called, that's usually they can find it on the refrigerator with the magnet, paper magnet, and that is the easy access for them. And having one in your wallet when you go see your doctor, so that you have it with you, so that if your blood pressure is not controlled, he needs to know what are you taking and how much are you taking. Because if he doesn't know what you're taking, he will not be able to advise you that day, okay, increase the dose or stop this and restart that. So having this list in your pocket and in an area which is visible to everyone in your house is extremely important. So self-monitoring, then you can make your list, paper list you can make, and you can mark down with your hand that, okay, took the medicine. That will make sure you will remember it, and you can, see that if you have taken it or not. People put alarms on their cell phones nowadays that, oh, it's time to take my medicine. That's another thing which you can self-monitor and remind yourself at the time to take the medicine. So then there are gadgets available, for different reasons, and we will only talk about the blood pressure. So having a habit of taking your blood pressure on a regular basis will also remind you that, yes, it's time to take the medicine, because you can notice that your blood pressure is high because you didn't take the medicine. So recording that data is also one way to remind yourself that, yes, we got to take our medicines to keep our blood pressure under good control. So the other thing which I think is, we cannot fix this problem unless we realize that this is a problem. Confessing. Maybe confess with yourself, confess with your spouse, your father, your mother, your parents, your colleague, your friend, your partner, that, okay, so I may be, I haven't been as taking my medication as I should. And maybe I have been eating too much ice cream in the evenings, which has raised my blood pressure. I have been having some salty foods. So confession is very important. That is that, confirm and make sure that problem is recognized. Once a problem is recognized, then you can find the solutions for it. So unless you don't recognize the problem, it's hard to find a solution. So then having a communication with your physician, with your whoever you're seeing, to educate yourself, learn about your medications. Most of the patients come to office and say, oh, I take a small blue pill, I take a large yellow pill, and I take a medium-sized white pill. So this kind of information, when you provide to your physician or your nurse practitioner or your physician assistant, is not going to be helpful, because there are too many medium-sized white pills, there are too many blue pills, and there are too many yellow pills. So learning about the medications, which medication you're taking, is extremely important. And then just don't go to the physician or pharmacist and don't question them or ask questions. If you don't understand anything, please ask them. Most of the physicians will be happy to explain it to you, or be happy to write down on a piece of paper, or in this electronic word, will be happy to print you the list of your medications. Then don't be hesitant to ask about the side effects of the medicines, because once you know what kind of side effects you're going to get or expect, you will be prepared to deal with them once you take the medication. So do ask and communicate about these things with your physician. And again, I will reiterate that, as I mentioned earlier, please take your medications in a bag, or the list of your medications with the appropriate dosage which have been prescribed, with the appropriate frequency of to be taken the medications which have been prescribed. That should be mentioned on that list whenever you go to see your physician or a primary care doctor or whoever you see for your healthcare. So what does it mean that why it's important to take the medications? So you have to reflect upon this. To take the medication because you want to improve your health. How will improving your health by using medications, and how it's going to impact your life? You've got to ask yourself, and then you will know the answer. You will be able to answer the question. Then how will this change allow you to engage in other meaningful areas of your life? If you're a healthy person, you have a healthy lifestyle, your disease is under control, by taking the medications, you'll be more active, you'll be more able to do more in your life by just taking your medications. So asking yourself and answering yourself about these is also very helpful for self-reflection and feeling better and living a better life. What are the measures we can take to get out of this habit if we have this habit of non-adherence? So as I mentioned earlier, first of all, we need to make sure that we need to identify the challenge. That yes, I don't take my medication regularly. Reflect on why this medicine is important. Why do you need it? Ask yourself why I'm taking this medicine, how it's going to help me, and how it will impact my life. Then consider linking taking medications with daily behaviors. If you perform a daily chore regularly, if you brush your teeth, put your pill box or the tablet, take it right after you finish brushing your teeth. Or any other activity in your life which you do on a regular basis, link taking of medications with those activities is always going to remind you to take the medications. Or, as I mentioned earlier, put the alarm on your cell phone that this is the time to take my medications. And if you find out that it's not possible for you to do any of these, if you're living in a household, ask for help. If your father is around, your partner is around, your mother is around, your brother is around, ask them, okay, you know what? You leave for work every 5 p.m. every day, and I'm home at 3 p.m. Please remind me before you leave that it's time for me to take the medicines. Again, using apps and pill organizers and putting them together for be taken, at certain times. Those are the ways to do. And again, please don't hesitate to ask for help. If you are not able to do it alone, there are ways and means and people around you who can help you with adherence of taking medications. So, if you are taking more than 1 or 2 or 3 medications, pill box arranging all the medication arranging in a pill box is a nice way in which you know that these are morning pills, these are evening pills, and there are 3 pills I take in the morning and 4 pills I take in the evening. Put them together so that you don't have to keep hunting the bottles at various times. Always store your medications together and out of reach of children, because those can be harmful for the children. Those should be placed somewhere higher so that children have no access to it. Take your medications, as I said, link with them breakfast, brushing teeth, before bedtime, leaving the spouse for work, things like that. So those are the few things which I'm mentioning again and again. The reason because those are the only few similar things which you can do to increase your adherence to the medications. So making pill carriers, pill containers. No, I always tell my patients who are traveling that when you are traveling, make 2 sets of medications. Keep one in your luggage, which you're going to check in, and one which you're going to take with you. So that in case you lose one of the piece of the luggage, whether that was in your hand or that was in your checked in luggage, so that you have one piece of medication, set of medications with you, whether that is your checked in luggage or in hand carry luggage. And again, don't leave them, in the cars, because those medications some of them are temperature sensitive and they can melt or degrade or lose their effect. Always put an alarm or means or ways in which you can find the time to take the medicines. And if you're not able to do it alone, engage your social support, friends, family members, to help you organize pill boxes and remind you with taking the medications at certain time. So these are the things I'm repeating again and again so that we can, because these are the ways you can help yourself so that you can keep taking your medications. In one of the slides previously, we said If our refills are not automatic, we are less likely to take our medications. So make sure you tell your pharmacy or tell your doctor, I want my automatic refill so that I keep getting supply of medications. Every week, put your medications in a pill box so that you have all set to be taken at a certain time. Link them to your specific behavior every day so that you remember to take the medicine. Ask your family, your friend, your spouse, your partner to remind you to take the medicine. Set up the alarm on your apps or the phone so that you get a second message. Those apps are available free to download on Android and on iPhone. Most of you already know that. So what are the evidence-based approaches? That what has proven effective in the studies? Education, why I take the medicine. What are the side effects? How much is the dose? If I remember to take, what medications name and why it's taken, is being prescribed for me to take it, how it's going to help me. Then interviewing your colleagues, your friends, or family members, it's called motivational interviewing, so that you can encourage them to take the medications. And then if you are suffering from this problem, then addressing the specific barriers, finding out, is this the financial reason I'm not taking the medicine? Or I'm just forgetful that I'm not taking the medicine? Or I don't like to take the medicine? So finding the specific barriers and addressing them is another way that this habit can be broken. And train yourself, self-management training, okay? Because if you have high blood pressure, you are going to suffer eventually. Your friend to whom you are asking for help may not have that much enthusiasm for you to take the medicine. So it always then comes to you, in which you can do the self-management training about taking the medications. And make it a habit. Do it every day. In 6 weeks, 8 weeks, it will become your habit. So a little bit, I would like to talk to if this video or this goes to people who are prescribers like me, in a healthcare profession, we need to empower our patients. We need to tell our patients that why these medicines are important, why I'm giving this to you, what to expect by taking these medications, what are the side effects, because two-way communication is very critical. It doubles the odds of your patients taking their medications properly, just by communicating with them. So what we hear in our office on a daily basis, I hate taking medications. Can you cut down this medicine? Like my last patient today asked me, can I stop this medicine? I said, but you cannot stop. Your risk of stroke is going to go high. But I heard it in the newspaper, this medicine is not good for me. So do not listen to those news or the press articles in the newspaper. Always discuss it with the patients. My patient was very compliant, so he asked me, but again, I do see patients who stop it and then come and ask, and that may have, caused the harm already. Then, we do it for a living because we see patients every day, and then again, this comes, whenever I come, you give me another medicine. Okay, the reason we give it because your blood pressure was not controlled. So understand why the doctor is giving you more medicine. And we do acknowledge, and we need to let our patient know as a physician that I know it's not easy to take the medications. And we have to tell our patients why it's important to take the medicines. And again, if we as a physician find out this, that our patients are non-compliant, we have to bend backwards to discuss with them, telling them what are the means, what are the ways, how they can link it with their behaviors to keep taking the medications. Then I can't tell that it really does anything for me. Actually, I feel worse when I take the medicines. I've been gaining weight since I started the medications. Yes. So we need to sit down with our patients, acknowledge it that some of the medications do have side effects, but the side effect you are describing has nothing to do with this medicine. So once patient understand that this side effect is not coming from this medicine, he will be more adherent to the medications. Then explaining this to the patient, as I mentioned earlier, how this is going to make you feel better. And always, always, as a patient and as a physician, we need to have a shared decision making. We have many patients who say, Doc, if you give me even the medicine, I'm not going to take it. So that patient, then you have to sit down and convince first before prescribing the medicine. And then that patient has to get convinced and understand. And it's the responsibility of patient also to ask more questions, explain the reason why you don't want to take the medicines, because that may not be the reason, that might be a totally irrelevant thing for the related to that medicine that you don't want to take it. So those are the things in which only comes by communication. So again, medication non-adherence is a significant problem. It's financial bad outcome is huge, even we cannot even think how bad, up to $250, $300 billion for a year. So recognizing the problem, finding the challenges and addressing it, and talking to your physician, communicating and understanding why you're taking the medication, and keeping the list of those medications in your house and in your wallet, and taking them to your physician on a regular basis. Those are the ways to stick to taking the medications. And the best thing is, these medicines will definitely prevent when I'm talking about the antihypertensive medication, the blood pressure medicine, prevent the heart attack, the stroke, because high blood pressure is a silent killer. You may not have any symptom till stroke or heart attack happens. So make sure, take your medications regularly, on time, in the frequency and the doses they have been prescribed. Thank you very much for your time and listening to me. And now, if you have any questions regarding your medications, I'll be happy to answer any of your questions. But always, always, please discuss it with your physicians or the care provider. So it seems that we don't have any questions at this point. So thank you very much. It has been a pleasure, and we will come back in 2 weeks to discuss about the hypertensive urgencies and emergencies. All right, good night. And now Jenny will explain you how to take your blood pressure and explain you what, demonstrate in front of you. You all have a good night.
Thank you, Dr. Mirza. As we've talked in previous workshops, and as Dr. Mirza just mentioned in terms of adherence, one of the important parts of that is to monitor and take your blood pressure. So another reminder is I do have these self-monitoring devices available to any of you who've been unable to obtain one. Remember that when you get up in the morning, you should move around a bit, use the bathroom, and avoid any caffeinated beverages, as well as exercise prior to taking your pressure. You'll have a monitor. It does have the tubing that disconnects. It gets plugged in on the side, usually color-coded. Then the cuff goes on. The tubing comes out of the bottom of the cuff. It goes on your arm above the elbow. You want to line up the tubing with the center of your inner elbow and then tighten, keeping that tubing there in the center. And sometimes it gets a little tricky. I'm just going to get it slightly tightened before I pull it up. And this takes a little bit of practice since you're doing this kind of one-handed. So it helps to get that a little bit tighter. When you place it, you might have to adjust. And then it should have a couple of fingers that you can kind of tuck in there. Your arms should be resting on a table about the height of your heart or kind of equal to your chest. And then you would simply turn on the device. Both feet flat on the floor, back up against the back of the chair, and then quiet while the pressure is taken. So you shouldn't be having any kind of conversation when you are taking your pressure. Once it's completed, record the reading that you see, the time it was taken, as well as your pulse. And then make sure that you take that information to your next appointment so that they can see the pattern of your pressure. And then you should take the device as well, as they can compare results from the pressure that's taken in the medical office as well as the pressure that you're getting on your device. All right. Again, thank you for joining us tonight, and we hope to see you in a couple of weeks. Bye now.